The learning pandemic is what I call the pandemic that we have just dealt with in Australia. We have just come out of the flu season. We're going into summer. The vaccine is rolled out. So in a sense, the great deal of activity to address H1N1 is behind us. That being said, that pandemic was predicted very early on to be highly deadly as well as broad spread. In reality, it did not turn out to be as deadly. It was deadly, and we have to acknowledge that, but it was not as deadly as we thought it might be. Based on our experience in Australia, I've coined the phrase learning pandemic to refer to the fact that we should be learning from this. Our pandemic experience in Australia taught us that the plans that we have in place for pandemics will be tested and that there are opportunities in a milder pandemic to fine-tune those, to work on better relationships, better connections across sectors and disciplines, to, in a sense, apply more health promotion principles, the things that we know work and are effective in empowering communities, keeping communities informed and educated, and giving them a sense of control over what's happening. That's what mainstreaming health promotion is. And so what I'm saying is that we need to use our experiences, we need to learn from the pandemic, that's why I call it the learning pandemic, and we need to use that to mainstream health promotion across many of our sectors. And though we may not even call it health promotion by name, that's what it is, that's what we're doing, and the result is the same. Those communities who have good health promotion practices and principles in place will be better prepared to respond to any pandemic or any health emergency. We're very fortunate to have a government that is inclusive and has already started thinking along the same principles of health promotion. They would not be able to identify that is health promotion. They would call it being inclusive. They would call it giving the communities a fair go in the participation. So it's about participation for them, not about health promotion, but the end result is the same. And one of the things that I've been struck by in this conference is there is an awful lot of really good health promotion, what we would call health promotion, taking place in many other disciplines and sectors. And we sometimes don't give them enough credit for it. And if we actually did an assessment of the health promotion that's actually taking place not under the name of health promotion, we would find that there's a huge amount there, and that we might use that as an entry point for closer partnerships and collaboration. It's really about functioning better, and if we ask ourselves, particularly in the government sector, what is government for? Government is for making sure that the livelihoods and the well-being of the population are served as well as the government can do so. In a sense, government is for health promotion, and mainstreaming it is, in a sense, getting it more profoundly embedded into all sectors. But I think it also should be about giving credit to the other sectors for the health promotion work that they already do and working with them to do it even better. Well, we've just come out of a session where we have had the first draft in multiple languages that has been presented to the conference attendees. We have seen that draft contains dot points or areas of content from each of the streams of the conference. There is, as in any first draft, a little bit of inconsistency about what's being done and how it's being presented. That's being discussed and debated in working groups. We're providing feedback to the writers. Some of it is about getting rid of health promotion jargon. Some of it is about really embedding the concept of mainstreaming rather than creating a special place for health promotion. It's actually about putting health promotion across everything that's done in communities. So there are some heated moments in the discussion. There is sometimes people want an either-or solution, and sometimes you have to say, well, really, if this document is prescriptive, the more prescriptive it is, the less applicable it is across all those contexts. And we really want this document to be able to be applied by everyone from the tiny village in Burundi to the major cities of the world.